Thanks for staying with us. So according to the World Health Organization, universal health coverage is of utmost importance towards ensuring everyone can have access to health services they need without risking financial hardship from unaffordable out-of-pocket payments. It is the best form of financial protection and provides healthcare coverage, from health promotion to prevention, treatment, rehabilitation, and palliation. Joining us on the show is the MD, Bastion Health, Naomi Aduku, to come and enlighten us about this. Good morning, Naomi.
Good morning.
Thanks for joining us today.
Thank you for having me.
So I would like to understand this healthcare coverage, why you think is important that people or organizations should come under this for their workers.
Okay, so let me just speak briefly about what health insurance is. It's basically financial protection against ailments, sickness, just to ensure that you're not, spending out of pocket, because, sickness doesn't tell you when it's coming. It doesn't knock at your door to say, hey, I'm coming on Tuesday or I'm coming on Wednesday. So that financial protection is you setting aside something to ensure that truly when that happens, you're able to, have that cover at the point you're in the hospital. But where people don't have it, what happens is, you can easily have a financial catastrophe. One sickness away from financial catastrophe. Today in Nigeria, we have less than 5% of the population covered by health insurance. So everybody's paying out of pocket.
Yes.
That's really, really expensive. But if you're able to afford a plan, to buy a plan, a healthcare plan, that's protection. If we're able to protect our assets and everything else, why can't we protect our health? And like they say, health is wealth. Yeah. So why not protect yours? So that's the basic, principle behind coverage health insurance.
So that's how Bastion Health, how does Bastion Health now fit into all this?
Okay, so Bastion Health is a health maintenance organization which has been licensed by the national body, which is the National Health Insurance Authority. So we're one of the private health providers to be able to give plans to individuals, corporate organizations, and SMEs. So you buy a plan from us, which ensures protection through our network of healthcare providers. That's how you're able to access care at any hospital you go under the Bastion coverage.
What role does government play? Because when you were talking health insurance, I was remembering the National Health Insurance Scheme, how it went up and all the drama it had, and state governments, can't they just do this instead of private? And how does that work? Okay,
so the government plays a regulatory role and also an operator role. Today we have what is called the National Health Insurance Authority. It used to be the National Health Insurance Scheme, but as of last year, the former president passed into law the National Health Insurance Act, which now mandates that all Nigerians must be covered, mandatorily, have a healthcare cover. So that's the role of the government. And also the states, you have the state health insurance schemes as well. So the states now are mandated to ensure that all their residents are covered, by healthcare. So I think that's a step in the right direction, ensuring that truly people will now have some kind of health cover, and even the vulnerable groups who could not necessarily afford these plans now have that cover, provided by the state governments. So that is a step in the right direction.
Compliance is encouraging as well.
Of recent, the operational guidelines have been, provided by the regulatory body, which is NHIA. So that would ensure that truly, in terms of compliance, this is happening across states, across the formal sector, and even, the private sector and the SMEs and individuals as well will all be covered. We would see, I'm sure, implementation as we go on, and that would ensure compliance.
So one of the challenges when it comes to health cover, my dad went through that, was that when you're trying to swap between HMOs, not just HMOs, between hospitals, like maybe you want a particular consultant and the service you want isn't available in the hospital you are enrolled in, having to go to another healthcare system is always complicated, because it'll be like, oh, your record is here, the HMO coverage is only on this particular hospital. What is the benefits from
Okay, so that brings me to, I mean, why choose Bastion? Bastion Health. We are changing the narrative, really, and these are one of the issues. There are a lot of issues. I mean, poor service delivery, transparency, something you've mentioned now around the network being very limited. But with Bastion Health, what we've done is, provide a roaming service. So under the plans, you have several hospitals. You're not limited to just one hospital. You're not limited to two. We understand that as even mothers, we have pediatric hospitals for children, which are different from, the hospital you would go to for care. So we have several hospitals under our plan, which ensure that you can go from hospital to hospital. The other thing that we've done, is using technology to drive service. Today on our mobile app, you can easily locate the hospital or service provider closest to you. That's one way. Second thing is this thing you speak about, your medical records. So today on my mobile app, you have your medical records sitting on the mobile app, such that if I went to Bauchi State, I can easily call up my medical records for a doctor there to be able to see. Wow. We do that, I mean, in the financial services sector, you can go back and get your bank statements for the last 10, 20 years. So why not do this in the healthcare space as well? So those are some of the things we've tried to drive to ensure convenience. So you can register with Bastion and you will not be limited to certain hospitals. But where there needs to be a referral, for instance, for secondary care, we're able to provide that to say, okay, we're referring you to this hospital. At the click of a button, we have a 24/7 channel, multi-channels of communication where enrollees can reach us. So you can actually, at the click of a button do that. Or even the hospital can get through to us and we will quickly refer the patient, because we understand that, honestly, with healthcare, it's a very, important issue, and it's usually, an issue between life and death. So in terms of response, we need to be quick to respond and ensure that there's that convenience for you to get the healthcare you need at the time you need it.
So let's talk about the categories, because I've been in some healthcare insurance scheme, and I know that they have different levels depending on what the organization is willing to pay on your behalf. And so some persons complain that, when they go to the hospitals to access some sort of healthcare, they don't get it. They get very cheap things like paracetamol, the drugs that they really need, they will be sent out to go buy from outside. So how do you arrange your categories in such a way that even the company that pays the least will still be able to provide at least some sort of quality healthcare for their workers? Okay.
So across categories, we have several different products across and several different price ranges. So, I mean, just prices that suit your pocket at any point in time. So it's not something to break the bank, but some people want, something that is a bit more elaborate or customized. We're able to do that. So we provide plans we have 3 key categories where we provide plans. So the individuals, we provide plans across about 6 or 7 plans, from the lowest as much as 18,000 to about 230,000. So it depends. We also have in the SME category, because we understand, yes, the informal sector is largely driven by the SME category, and they have less than 10, 15 workers per se. So we have plans across that category from 20,000 all the way up to about 200,000. And then we have for the corporate space where you have larger numbers. So we're able to, provide those kind of plans. So depending on the plan you buy, that also determines, the hospital network you're in, and also determines, the service. There's some exclusions that might apply in terms of pricing. So it's always important to look at the plan choice that you're about to make, vis-a-vis what you think you really want.
Okay, so before we let you go finally, how would people reach you? Do you have a website or something?
Oh, yes, we're online. We're on all the social media handles, Instagram, Twitter, LinkedIn, and then we can also be reached. We have several offices across. As a national HMO, we're supposed to be in all the 6 geopolitical zones. So today we have 2 offices in Lagos, one in Yaba, one in Victoria Island. Okay. We have offices in Ibadan. We have Enugu, Kaduna, Port Harcourt, Abuja, and as far as Maiduguri. People ask why, but truly you have NGOs that are serving, you know, the IDP camps there who need this service. So we're providing that. We can also be reached on a phone number 0800 Bastion, which is 0800 227-8466. And we can also be reached at an email, wecare@bastionhmo.com.
Thank you so much for enlightening us. We've been speaking with the MD Bastion Health, Naomi Aduku.
Thank you very much.
When we come back, we have another sponsored segment. Stay with us.